Oregon Health Authority Communications. This is a media availability to answer questions about the West Coast Health Alliance's announcement that it's continuing its endorsement of the American Academy of Pediatrics recommended child and adolescent immunization schedule. With us to discuss this is Dr. Dean Seidlinger. He's health officer and epidemiologist at OHA's Public Health Division. Just a few reminders. Please make sure to include your media affiliations so we know that you are media. If you are not media, we ask that you hop off right now and join the YouTube live stream, which was in our advisory that we sent last night and this today. And I think it's in the chat. I haven't looked at the chat, but I think it's in the chat. If you want to ask a question, please use the raise your hand function. That is, you can find that at the react button at the bottom of the page to be added to the queue, and I'll open the floor in the order in which hands are raised, or just drop a question in the chat and I'll ask it for you. Please mute your audio when you're not asking a question and when you're done asking a question. We will take one question at a time. If you have a follow-up, we'll take care of that after everyone's asked their questions. And then just a reminder that the YouTube recording, the YouTube live stream will become the recorded stream, the recording of this media availability. So, and with that, I will turn it over to Dr. Seidlinger.
Thank you, Jonathan, and thank you all for being here and helping us get the word out. I want to say a few things about what we did yesterday and then leave plenty of time for questions, because that's why we're here, to answer questions about yesterday's decision by the CDC to revise the immunization schedule for children and adolescents. We know that this decision raises many questions for families throughout Oregon and the country about vaccine access and availability. The decision significantly reduces the number of vaccines routinely recommended for all US children. And the decision did not follow established vaccine policy procedures or the usual expert review process. So in response to the CDC's announcement, the 4-state West Coast Health Alliance, of which Oregon is a member, late yesterday issued a statement affirming its support for the American Academy of Pediatrics immunization schedule for children and adolescents, which is based on decades of safety and effectiveness data. I want to talk to parents first, before I give more of the details. Not just as a public health official, but as a pediatrician who has talked with thousands of families about vaccinations over the years. The American Academy of Pediatrics has long made vaccine recommendations to help protect the health of kids. The AAP recommended schedule remains the standard for protecting children's health. It's based on who's getting sick, who's at risk for getting sick, when children are most vulnerable, how well the vaccines work, and the safety of those vaccines. It's meant to guide conversations between families and healthcare providers, and parents should continue making informed decisions with their child's doctor or other provider, as they always have. These changes are not expected to affect insurance coverage for vaccines this year, so families should not have any new costs when they choose to protect their children with recommended vaccines. As of December 31st, 2025, all recommended child and adolescent vaccines remain available and continue to be covered by public and private insurers, meaning those recommendations that were in place by the federal government at the end of last year. And this covers all of the AAP recommended vaccines. So why does this change matter to all of us? Well, it matters because the CDC's changes to its vaccine recommendations increase the risk of vaccine preventable diseases amongst children. When children get sick, it leads to missed school for the kids, missed work for parents, and most importantly, increased hospitalizations, and tragically, in some cases, even death. And no parent wants to see their child sick. And the recommended vaccines offer them the chance to keep their child healthy from many infectious diseases that commonly circulate. The changes do not improve child safety, as the CDC would have you believe, but rather increases the risk for children and adolescents by creating confusion for families and providers who are trying to cut through the information provided. So what does the science say, and why did we make this decision yesterday? The American Academy of Pediatrics recommendations regarding vaccinations for children and adolescents consider many things, like when children are most vulnerable to disease, when vaccines work best with their developing immune systems to train their body how to fight off those infections, the safety of vaccines, the disease risk in the United States, access to care and immunizations in the country, and the cost effectiveness of national vaccination programs. None of the CDC's recent changes are based on new safety or effectiveness data. And in fact, the data it's based on weren't really shared with us. So what was different about this decision? The previous CDC recommendations prior to last year were based on the Advisory Committee on Immunization Practices, which used a rigorous, transparent review process. The January 5th changes were based largely on comparisons with other countries, did not account for differences in healthcare systems, disease risk, access to care, and were not reviewed by medical experts, public health organizations, providers, or the general public before release. This all happened in the past. So the West Coast Health Alliance continues to endorse the AAP recommended childhood immunization schedule, to review the vaccine science as it evolves, to work within our states to ensure continued access to recommended vaccines. And each state is looking at how these federal changes may affect vaccine access locally due to our individual state laws and rules. The West Coast Health Alliance and the AAP strongly support these long-standing science-based vaccine recommendations that protect children, support families, and importantly, respect the informed parental decision-making that happens around vaccines. Public health guidance must be grounded in science, safety, and transparency, and we are committed to maintaining that. I'd like to now open it up for questions, Jonathan.
Okay, thanks, Dr. Seidlinger. If you want to ask a question, use the raise your hand function that is in the React button area to be added to the queue. I'll open up the floor in the order in which raised hands are received. Okay, we have a question from Tanvi Varma at KATU. Go ahead, Tanvi.
Thank you so much. There's confusion about which guidance medical professionals should follow. What are you all doing to make sure there's consistent medical advice being given out?
So I will speak for what we're doing here in Oregon. We met with our partners from Washington, California, and Hawaii yesterday to say that we continue to endorse the American Academy of Pediatrics recommended vaccines, and we put out a statement last night. We are communicating that statement through our health alert network with providers across the state to say that for childhood vaccines, follow the AAP recommended vaccine schedule. These vaccines will continue to be covered as they were at the end of 2025. We are working with our immunization providers who've signed up for the listserv to put a similar message out to them. And we're working with you guys in the media to get the word out to the public, including the medical professionals and the healthcare providers who will read your stories and listen to your stories and watch your stories to tell them that the American Academy of Pediatrics science-based vaccine recommendations are what people should be following in Oregon, and there are no changes in Oregon based on the federal HHS announcement yesterday.
If I might just quickly follow up to that, what are you all going to do to prevent potential fallout from the CDC, given that this is different from what they're advising?
I think we see it as in alignment with what the CDC had advised before independent experts and those who advised the CDC, whether from the Advisory Committee on Immunization Practices or the professional organizations that include the providers who provide the healthcare here in Oregon, had recommended that we are looking at what is the risk of disease for children here in Oregon, what is the effectiveness of these vaccines, how well do they work, and how safe are they? The vaccines on the schedule are incredibly safe. They work very well, and we've seen dramatic decreases in disease. So I'm not worried that standing on the side of science and providing factual information to parents in a doctor's office, clinic, pharmacy, or wherever they're getting their vaccines is the way to go to offer children that best protection and parents to make an informed choice.
Thank you.
Thanks, Tanvi. Next question is from Amelia at OPB. Go ahead, Amelia.
Thanks. I'm wondering what this means for the ability of pharmacists, including pharmacists and retail pharmacies in Oregon, to provide the flu shot to children and other vaccines that have been placed in that shared clinical decision-making category by the CDC.
Right now, we expect. Could you mute, Amelia? Oh, thanks. Right now, we don't expect any changes to pharmacists or other healthcare providers in being able to provide vaccines. Pharmacists, nurses who are able to provide vaccines, and physicians who are able to provide vaccines all can participate in shared clinical decision-making. That conversation between an individual and the healthcare provider to offer that vaccine, between a child's parent and the healthcare provider to provide that vaccine. So there should be no changes in the availability of flu or COVID shots in pharmacies. We addressed many of those issues in the fall, in September, when the federal government again made decisions that weren't based on changes in how well vaccines work or safety. And we worked with the Board of Pharmacy to make sure that we could maintain that access in pharmacies. And we are continuing to have conversations with the Board of Pharmacy, the Board of Nursing, the medical board, our Medicaid program, our insurance regulations, and other state agencies to see what issues they anticipate arising so that we can try and address them.
Follow up from Amelia. Go ahead.
Yeah, this is an additional question, so if you need to go to other people first, that's fine. But I'm wondering if physicians in Oregon are obligated to follow either set of recommendations, the AAPs or the CDCs, or if the situation we're in now is simply that the CDC is urging physicians to recommend shots on a more limited basis. The state is urging physicians to recommend the same suite of preventative vaccines, and that it's ultimately now up to physicians to choose how they behave with their patients.
Thanks. Thanks for that question. I think nothing has changed right now in the landscape. The West Coast Health Alliance, including the Oregon Health Authority, recommends that clinicians follow the AAP recommended childhood vaccine schedules. That is what it is. It's a recommendation. These are the vaccines that are recommended, when they're recommended to be given, spacing between vaccines, and the recommendations that we hope our providers will follow. Prior to last year, the American Academy of Pediatrics and the CDC recommendations aligned, so providers didn't have to make a choice. We are urging them to follow the AAP recommendations because the data and the evidence are laid out behind those vaccines, why those vaccine recommendations exist, and that we're done in a public process before they are added to that schedule. The recent changes to the federal recommended vaccine schedule did not follow that same process, and there was no data shared that said these vaccines have become less effective or more unsafe, or that the situation in the United States has changed where different groups are at risk. So we recommend that they continue to follow the science, which right now underscores the American Academy of Pediatrics, West Coast Health Alliance aligned recommendations.
Thanks, Amelia. Next question is from Andrew Schwartz with Willamette Week. Go ahead, Andrew.
Hey, my question is, if I was hoping you could talk through the ways that Oregon's vaccine guidelines are formally entangled with federal vaccine guidelines. Like Oregon Families for Vaccines was saying that other states in the West Coast Health Alliance, like Washington and California, have done more than Oregon to formally disentangle themselves in the various contexts. And I'm just trying to figure out, okay, what does this mean in practice? So I was hoping you could talk through, like, what are the ways where, yeah, at a structural level, the way different bodies in Oregon establish vaccine guidelines is currently linked to federal guidelines, and how, if at all, does the West Coast Health Alliance change that?
Yeah, so let me address that in a couple of different ways. First of all, each state the District of Columbia and Territory has their own kind of state laws and regulations that guide vaccines and insurance in other markets. So not just the 4 states in the West Coast Health Alliance, but across all states. We have to look at our individual state laws and state rules to determine, how to implement programs. We did that, if you can recall, in the fall when the federal government changed the recommendations around recommendations for COVID vaccines and flu vaccines, that we worked with our board of pharmacy, with our other medical board and nursing board, with our insurance regulator and others to ensure that vaccines remained available and at no cost to folks in Oregon. Our neighbors to the north and to the south and in Hawaii, had to make different changes to ensure those vaccines were available, but we all made changes within our regulatory framework. We continue to have those conversations with our state agency partners, with partners in the community, to determine what are some barriers or questions that they're hearing, and do we have the tools already to overcome those? Is it a lack of communication, a lack of clarity in our recommendations, or do we need to look to make other changes? And we'll continue to do that in alignment with our partners, and the governor's office. But the announcement we made yesterday to continue to align with the American Academy of Pediatrics recommendations don't change access or payment for vaccines here in Oregon. They remain the same as they did at the end of last year. And if the federal government makes additional changes that necessitate us making changes, we'll look at those. I will say, though, that individual states can't make up for all of the decisions that rely at the federal government. The federal government, through the Vaccines for Children's program, provides the cost of vaccines for over half the children in this country. That means they're paid for through a federal program and provided to states, which we distribute to our partners. Right now, there has not been an impact on the Vaccine for Children program availability, and so we're still able to draw down those vaccines from the federal program and provide them to our healthcare partners and other providers to give to children. If the federal government makes changes in that program, we'll have to look for additional revenue and things to make up for that. But right now we haven't had to do that, but we'll continue to examine our own state regulatory environment and federal changes to do what we can within Oregon, and maybe looking at our neighbors to see if there are ways that they have that would work for us to maintain access and maintain cost-free vaccine access for parents for their children and for all of us for those vaccines that are recommended to keep us healthy.
Thanks, Andrew. Tammy, I see you have a follow-up question. Let me just really quick, if you don't mind, if I could just go to Heather Roberts at Oregon Radio News Network to get her question out. I'll come back to you, okay?
Of course.
Go ahead,
Thank you.
Heather.
Dr. Seidlinger, 2 related questions. You mentioned specifically that this would not impact anything this year for insurance payments because those are based on guidelines in place as of the end of the year, and this didn't take effect until after the first of the year. But what does that mean for next year for Medicaid reimbursements for kids on the Oregon Health Plan when we start? Are we going to run into an issue of the state guidelines versus federal guidelines? And then also related, school requirements. Are we going to see a different host of school requirements for kindergartners and on the way up?
So let me take that second part first. Individual states establish school entry requirements for vaccines. Many states have a reference to the Advisory Committee on Immunization Practices or to CDC recommended vaccines, but in Oregon, those vaccines are we have an advisory group that comes together that recommends if vaccines should be added to that schedule or taken off of that schedule, and the decision and the authority for adding vaccines or changing that schedule relies with the Oregon Health Authority. And so that will not change. Education is provided to parents who are choosing to opt out of vaccines so they know the benefits of those vaccines versus the risks so that they truly are making an informed decision. But right now, those decisions, at least in Oregon, aren't impacted by these changes at the federal level. As for predicting the future, particularly the future, in light of the current administration, that's difficult because there have been changes that have made that none of us were expecting. So what I can say is that as of now, and even in the HHS announcement yesterday from our federal partners, they assured that the vaccines that are currently required to be covered under plans regulated by the Affordable Care Act, under public plans like Medicaid and the state health insurance program, which covers many children, will continue to be covered at this time. So we see that in place. We've been having conversations with our state agency partners, with the governor's office, with our fellow states to see if further changes are made, what might need to happen at a state level to ensure continued access to safe and effective vaccines that are recommended based on the evidence, and we'll continue to cross those bridges as we need to. The major kind of group that represents health insurance plans has said that yes, for the current year, they're going to continue to cover all of these recommended vaccines. This is made because they've already set their plan benefits. They've already set the rates for this year. And as important as vaccines are at keeping people healthy, keeping people out of the hospital, and keeping people from dying, we know that they also save money. And insurance companies are certainly in the business of trying to save money. So it makes financial sense, and it makes sense for us as Oregonians to continue to vaccinate. So I don't anticipate any changes even in the coming year. But again, predicting the future is quite dicey these days.
Thanks for the question, Heather. Tanvi, go ahead with your follow-up.
Thank you. If it's okay, I have two questions, but one is just a clarifying question. Any chance you could just give us a list of the vaccines that are no longer being broadly recommended?
Sure, if I can get there. So per the federal announcement, so vaccines were put into three different groups that are those vaccines that continue to be recommended for all children. So this includes vaccines against measles, mumps, rubella, polio, pertussis or whooping cough, tetanus, diphtheria, Haemophilus influenza type B or Hib, pneumococcal disease, human papillomavirus, a common cause of cancer, and varicella or chickenpox. The vaccines, the other vaccines were moved into separate groups based on risk factor, and some that were recommended for shared clinical decision making. And I can pull that up for you in a moment if you need to. But most vaccines are continuing to be recommended for all children. But again, in Oregon, we recommend sticking with the American Academy of Pediatrics recommendations, which are based on the situation in the United States and the safety and effectiveness of those vaccines.
Thank you. And just quickly, my last question is, aside from spreading awareness, what are you guys going to do to address the fact that Oregon has a vaccine opt-out rate higher than ever before?
We're going to continue to work with our partners in the media, with other folks who people trust to get fact-based information out about what vaccines do. Oftentimes, those who are skeptical of vaccines, who are opt out of vaccines, are hearing just one side of the story. They may be hearing about potential risk factors from vaccinating, or even unproven consequences of vaccines. They're not hearing necessarily about what those vaccines do to protect people, the tremendous impact that we've seen. I'll just go to a few recent examples. For almost a year now, the United States has been dealing with an ongoing transmission of measles and multiple outbreaks that are linked. We had not seen an individual in the United States die from measles in decades. And last year we saw 3 people die from measles. Totally preventable diseases in individuals. Let's look at some other examples. Rotavirus, which many people think, and any parents or anyone who's been sick with rotavirus knows, you can feel miserable for a few days. You have diarrhea, and many people recover. But prior to using the rotavirus vaccine routinely in the United States, 70,000 young kids were hospitalized, mostly due to complications from dehydration. That has been virtually eliminated. We're not seeing that kind of hospitalization. 70,000 kids kept out of the hospital. More recently, when we started using immunizations in pregnant women and young infants to protect against RSV, we've seen an incredible decrease in RSV hospitalizations. So over the last couple of years, we've seen that number of hospitalizations cut in half. And this is the most common cause of hospitalizations in kids, in infants in the winter. It's cut in half. And for an individual child, for a parent making that decision about their child, if their child is immunized, that child has an 80 to 90% reduction in needing to be hospitalized with RSV. So these, the tremendous positive impacts of vaccines are often overlooked when people focus on theoretical or disproven side effects. And so we'll continue to get the word out. We'll continue to work with anyone who's trusted in the community to provide them fact-based information, and to get that information in front of parents so that they can make informed choices, so that they can ask questions of their providers, get their questions answered, and hopefully make a choice to protect their children.
Thanks, Tammy. And we'll take one more question, and that is the follow-up question from Amelia at OPB. Go ahead.
Thanks. HHS in their statements about this and the Secretary have claimed that they are aligning the U.S. vaccine schedule with 20 other high-income countries, Western European countries, Australia, Japan, Canada. Is it true that those countries don't recommend and pay for vaccination against rotavirus and meningococcal disease, or do you? Do you want to fact check or respond to that argument that this is to align the U.S. with our peers?
Yeah. So wait for you. So before I answer that question, let me say that the recommended vaccine schedule from the American Academy of Pediatrics, the one that was put out by the CDC prior to last year, wasn't based on minimizing the number of vaccines or maximizing the number of vaccines. It was really based on recommendations that would maximize protection for children and adults in the United States based on the safety of vaccines, disease circulating, who's at risk, and how well those vaccines work. As far as comparisons to other countries, each country makes their own vaccine decisions based on the resources they have, the availability of vaccines, access to healthcare, who's at risk for getting sick, what rates of hospitalizations or serious disease are they seeing from certain illnesses, and makes those decisions. Certainly, countries, vary widely, and we are in line, if you just count vaccines, with countries like Canada and Germany, and I believe Japan. But again, we don't make vaccine recommendations based on the count. We make them based on who's at risk in the United States, access to healthcare and resources and other things in this country. And there are vaccines that we don't routinely recommend that other countries do. For example, Japanese encephalitis. You might imagine that's more of a problem in Japan because it has it in the name. That's a vaccine that's routinely recommended in Japan because it's circulating more widely and people are more at risk. We don't recommend that here in this country. So again, we look at who's at risk, how our disease is circulating, what access to vaccines and vaccine delivery do we have in this country to make recommendations that allow parents to have that informed conversation with their child's healthcare provider to offer protection with these safe vaccines for their children and the broader community as we encourage people to be vaccinated and diseases spread at a lower rate.
Thanks, Amelia. And thanks, Dr. Steinlager. We'll go ahead and call it. Thank you very much, everyone, for joining today. If you have any follow-up questions, please send them to the email that was at the top of the advisory today. It's phd.communications@oha.oregon.gov. You can check out the YouTube recording. I put the link in the chat. Let us know if you have any other questions. Have a great day.
Thank